Hello once again, and welcome to the program, Your Doctor and COVID. I'm your host, I'm Dr. Mahendra Carpen, the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. We continue to discuss the COVID-19 pandemic. Yesterday we started talking with Dr. Hemchand Baran about the nephrology areas regarding the COVID-19 pandemic. Nephrology, as we know, is the science of the kidneys and all of the renal system. Dr. Baran is a nephrologist, recently returned from training in Hamilton, Canada at McMaster University. Remember, if you have any questions, especially surrounding the COVID-19 pandemic, feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. We continue our conversations with Dr. Baran, and for the remainder of this discussion today, we will take our masks off because we are more than 6 feet apart from each other, and it is considered safe for us to be able to take our masks off. Welcome again, Dr. Baran.
Thank you, Dr. Carpen.
Thank you for all that you shared with us yesterday on the program. So one of the things you spoke about yesterday extensively was dialysis. And I wanted you to just explain to our viewers and listeners, what is dialysis and what is meant when you say that you have patients who are on dialysis? This is one of the main interventions that fall under the expertise of a nephrologist like yourself. But explain to us, what is dialysis?
Okay, thank you again. So dialysis is basically referred to as a function that where the patients are placed on a machine, and it does the function of the kidney. So before I continue explaining dialysis, I just want to touch briefly on what are some of the functions of the kidney, so you can understand a little bit more better some of the things that dialysis would do to replace the function of the kidney. So your kidney basically helps to regulate your blood pressure. It controls volume, and that's why you're making so much urine. It regulates certain hormones, and it also helps to build your blood count. That's your red blood count, as you would know. It also helps to regulate certain minerals and excrete certain toxins from your body whenever you eat, and it helps to eliminate certain medications. There are many other smaller functions that the kidney do, but these are some of the basic ones. So when your kidney stops working, these are the things that go wrong with your kidney. Your blood pressure started to get extremely high, you started to accumulate toxins, the regulation of certain minerals in your body started to accumulate, and your blood count, or your red blood count, started to fall. And you present with a lot of signs and symptoms of kidney disease. So basically, dialysis is a process in which you are connected to a machine through a catheter or a big tubing that plays into one of your main blood vessels, and it kind of circulates your blood. It goes through a filter, and the filter is actually what acts as your kidney, and the filter is what does most of the cleaning, and your blood is returned to your body. So that's a basic overview of what the term dialysis actually means. Right. A basic replacement of what the kidney does.
Yeah. So we use a lot of, so that is called hemodialysis that you described there.
Correct.
And sometimes, I don't know if we utilize it a lot in this country, there's peritoneal dialysis that we use the membranes in the tummy, in the belly, to actually assist with some of that function. Do you practice that in Guyana to any large scale, the peritoneal dialysis technique?
We do have peritoneal dialysis. We have a few patients, not a large amount, about 15 to 16 patients.
Okay.
That does peritoneal dialysis. It's a bit more of a technical process. It calls for a lot of patient education, patience, and commitment to peritoneal dialysis.
This is something that can be done at home.
It can be done at home. It's a bit more convenient than hemodialysis, and it's something I want to look into also personally, to see if I can expand on it, because it's quite a bit more cost effective also.
Okay. What do you anticipate to be some of the challenges in doing a peritoneal dialysis program, let's say?
So far, I've been trying to gather some information. So awareness of peritoneal dialysis is something that's is not known here.
Right.
And my biggest challenge would be commitment, patient education to this type of dialysis. We have been doing it. We do recruit patients for peritoneal dialysis. And the few that we recruit and I observe and look at and train them, the biggest problem is them being committed to peritoneal dialysis.
Okay.
Yeah.
So in the COVID era, everything has changed. The way we do medicine has changed. As it relates specifically to your dialysis program and your nephrology program, what different steps would you have had to take during this era? And let's talk about infrastructure and specific precautions, etc. At the Georgetown Hospital, before we moved the sick patients over to the Ocean View facility, we have had the luxury of a COVID ICU. And we had lots of patients there who would have had kidney diseases, who would have required dialysis. Tell us a little bit about some of the challenges and some of the differences you would have had to, or mechanisms you would have had to put in place to be able to manage those patients.
Okay, so as you mentioned, COVID, we're still learning about COVID. And
correct.
Isolation is the biggest precaution with these patients. So once they're diagnosed with COVID, we have to try to do everything in an isolated fashion. So we had to isolate one dialysis machine for these patients. So there's a different unit set up for the COVID patients.
Mm-hmm.
The nurses and the other staff who are involved are fully aware and were trained to use protective gears,
right,
and to self-isolate. It's a bit more technical, and they have to pay a bit more attention to these patients and the amount of time also they spend with these patients. But so far, we have an isolated unit for the COVID positive patients, and they are receiving their dialysis who required. The nurses are fully equipped and they are doing their part. We still having our challenges, but we are dealing with them. As compared to the regular setup for our regular dialysis patient, there are more need for equipments, utilization of more of the dialysis basic equipments. Mm-hmm. So it's still challenging, but we are still, it's a process in working, and we are still trying to improve what we are doing.
Do you think that we have met the needs for the population in terms of dialysis in COVID patients, not the general population, but COVID patients who were admitted to the hospital? Do you think we met the needs for those who require dialysis?
So far, it has been challenging. As I mentioned, we have one machine in place for our patients at the moment. Right. It has been working, and we have been varying how we dialyze the patients. It would be more beneficial and useful if we have another machine in place.
We have some more resources.
Once we have more resources in place, then we need more human resources also.
Right.
So more resources, more human resources would make it easier for us. So there is always the need for more.
Yeah. So you talk about human resources. What does the nephrology team look like? What are the persons or the human resource components of a successful nephrology team?
So it's a multidisciplinary team. It composes of its nephrologists. There might be doctors, other doctors not specifically nephrologists involved, our dialysis nurses, a dietitian, because nephrology or kidney patients have special diets. Pharmacists, they are also on specific medication that requires specific indications from our pharmacists to talk to them about that. So, and also because of the complexity of kidney disease patient, and it also tells a toll on the social aspect of their life. So also we have a social worker involved in their care. So it's a complex team that address these patients, and we sit together when we're ready to talk about one of these patients.
So in the dialysis unit, for example, or the nephrology unit in the COVID era, of course you have the professionals, the doctors and nurses and all of them, those you mentioned, but the machines and the area needs to be clean, need to be kept sterile, need to be changed over, etc. Is there any specialized training that was provided for the attendants, the cleaners, the helpers in that area?
There are specific attendants and super cleaners for our dialysis unit. And there is, I think there are more than one. Yeah, there is a technician there that we do service the machines on a weekly basis. And the water treatment, there is a specialized guy that comes in and look at the water treatment area. So there is a weekly service that's been provided.
And all of these people have been trained to deal with COVID patients and the COVID isolation, how to put on their PPEs, how to take it off and stuff.
The latter part that I mentioned of the staffing, they are not specifically involved with the COVID patient.
Okay.
The isolated, the unit for the COVID patient, whenever the COVID patient leaves, the area is being fumigated and sterilized. Okay. And then the other staffing will access that unit to do the servicing and other cleaning.
So I suspect that the regular helpers and attendants in the COVID unit will be the ones who assist in cleaning and preparation, etc., after a COVID positive patient would have used the service.
After it has been sterilized, fumigated and sterilized, they would,
Okay. Well, that's very good to know. Now, did we have to build anything new, any area, any infrastructure apart from the machine? Was there any new construction that happened to assist in managing these patients?
At the moment, at the Georgetown Hospital, there was a new area that opened up, a small section to accommodate the dialysis machine. It's equipped with the basic necessities. Not a full-fledged dialysis area that we want, but it served the purpose of what we wanted.
Yeah, well, that's, we're all learning as we go along in this COVID pandemic. We know, no one started out as an expert in this, but from experience, we are learning every day something new, how the disease behaves. We are now hearing about mutations, and at some point in this program, and another time, we will have to discuss for our viewers and listeners what the mutations mean for us as a population or for human beings in general. So we want to thank you again, Dr. Barron, for coming on to the program, Your Doctor and COVID, and sharing your expertise in the area of nephrology as it relates to the COVID-19 pandemic. Remember, if you guys have any questions or comments, feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you once again for joining me.